talking about our supplies. What is our current supply of ventilators?
Yeah, so I think I've previously reported that we have 104 ventilators, of which 9 are pediatric ventilators. So I've been corrected. I wasn't very far off. We have 103 total ventilators, of which 7 are pediatric ventilators. So we have 96 adult ventilators. We currently have almost 30 that are in use. So that would leave, 66 that are in stock, unused right now, ready to go. So those 30 are in use right now for cardiac surgery patients that are intubated, for a period of time immediately after their surgery. Patients that have suffered serious strokes, patients with pneumonia, patients with other respiratory conditions or other medical conditions that they simply can't breathe sufficiently on their own, they're placed on a ventilator for whatever period of time is necessary. And we do have those patients that are in the ICU. I mentioned that we have 12 positive patients that are currently in the hospital. 5 of them are in the ICU, and most likely all of them are intubated right now and using a ventilator. So those are the ventilators that are in use right now. So that leaves us with those 66, which under normal conditions, that would be plenty. But we don't know how quickly the surge is going to come and what it will look like. When I talked about the analytical model earlier, it shows that when we reach that peak point, whenever that happens to be, and again, it really depends on the shape of that curve. But for, again, this 2-county area of Kern and Tulare serving a little over 1.3 million people, we would need 390 ICU beds and 368 ventilators. It's predicted that that's how many we would need just to take care of the surge of COVID patients. So when I talked about us having 96 adult ventilators and about 66 of them available, I do know Sierra View Hospital has some ventilators available, and the hospitals in Bakersfield would have some that are available. But collectively, we don't have anywhere close to 368. So when I've talked in the past about needing more ventilators, it's not that we need them today, but it's to be prepared for tomorrow. And how quickly tomorrow comes, we don't know. And so just like most hospitals across the state, we're all putting in orders for additional ventilators. A ventilator costs about $35,000 for a single ventilator. So they're very, very expensive. And once the pandemic is over, we would never need, a couple hundred ventilators. The supply we have right now is quite adequate to take care of our normal population. So for us to go out and purchase, even if they were available, to go out and purchase, dozens and dozens of ventilators, we just couldn't afford to do it. So we're really looking for the federal government and the state government to help procure ventilators for us. But as we've contacted all of our normal sources, they're simply not there. They're not available. And that's why you see a lot of auto companies, car manufacturing companies, other companies that are retooling their factories to be able to manufacture additional ventilators is to help increase the supply. I think somebody told me, interestingly, that Governor Cuomo actually made a comment yesterday or the day before that New York now has as many ventilators as it needs. We read that the governor of California, Gavin Newsom, has agreed to send 500 California ventilators to the national stockpile to then be distributed to states like New York and New Jersey and Louisiana to help them, because they're approaching the peak of their crisis. And so I understand why folks on the West Coast, Oregon and Washington governors have promised the same thing, that we're not near the surge yet. You know, we may have 3 weeks before it begins to start. So send them back there for temporary use. They get over their surge, they cross the apex, and then they're sent back to us in time to meet the surging need that we